Thank you for inviting us to your group. I'm going to be speaking just ever so briefly, shocking as that might be, but just briefly about some of the work that we're doing in integrative health and wellness at USC and at Children's, and encouraging you. I just sent the link to our integrative health and wellness website at USC, but we are working diligently to bridge integrative health both at USC and at Children's Hospital Los Angeles. So it's nice to kind of, for me, I'm on both sides of the fence trying to make that happen. And we're leaning with evidence. So I'm going to encourage everybody today to be thinking not only about your own personal experience with integrative health and wellness, but also think about what are scientists doing to demonstrate that we see benefit for particular patients and populations around the use of integrative health. Because back in the day when we talk about CAM, which was complementary alternative medicine practices, people would just roll their eyes. They're just like, whatever, doesn't really mean anything to me. Or, oh, I did it once and it was really great for me. And they only think about their own subjective personal experience. But we're really trying to move the needle forward now to better understand the positive health outcomes associated with what I like to call integrative practice, right? Integrative medicine practice is not excluding biological, right? It's not only embracing integrative. Hold on one second. But you all as psychologists, clinicians, you are really truly gatekeepers of integrated care for your patients, okay, and for yourself, right? Because some of what we're doing today is about yourself, and it's very well known and documented and personally experienced that we're the worst at taking care of ourselves, right? So in pain medicine, we talk about biopsychosocial care and spiritual care. And today we're going to talk more broadly about how this is important also for you as a healthcare provider. Because as that old adage goes, when the cabin pressure changes and the mask drops, right? Put it on yourself first. You really have to take care of yourself. And I can't say it loud enough or long enough or often enough that if we don't take care of ourselves, we really become ineffective at taking care of others. And we see this happening right now at an all-time high, burnout, something called compassion fatigue, where you're just kind of tired of taking care of other people and you don't have it anymore. So we really are recognizing the importance of self-care. So again, I won't beat that drum for too long, but so two things. One is the biopsychosocial spiritual model of understanding health and wellness for yourself and also understanding that for others, and being able to then put that into action. And today, Gabrielle Lewis, as she's been introduced, is going to be working with you, educating you, and also providing you with experiential experiences to get more in touch with the kinds of principles that we're talking about that she'll illuminate further. But I encourage everybody to pause and be present. It's nice to see some of you on camera. I know a lot of you have your cameras off. It seems to have become a culture where we're going kind of like dark on our video cameras, but if you feel ever so inclined to turn them on and be part of the conversation and part of the experience, I encourage you to do that, because this is not about multitasking and doing 19 other things while you're on your presentation just to check the box. This is really a time to take care of you. This is a time for you all to plug in, be present, and do some work that's going to be good for you. So hopefully you can flip your cameras on and be part of the conversation and part of the experience. If you can't, that's okay. There's no judgment. I'm just trying to let you know that this is not just a didactic where we're just going to talk at you for an hour and then you're going to go back to your business. This is for you. And that's what was asked of us, was to bring on a topic and an experience that's going to be for you, the faculty and the staff. So thank you so much for inviting us. It's wonderful to be here. Like I say, my favorite group next to Ped Psych is adolescent medicine. It's no secret to everybody that adolescent medicine is one of my favorites. And so thanks again for letting us be here. And I'm going to pass the baton and remain quiet and send it over to Gabrielle, and we'll go from there. So thank you everybody so much, and look forward to our hour together.
Thank you, Dr. Gold. That was beautiful. And thank you, Hayden, for your beautiful, warm introduction. My name is Gabrielle Lewis, and it is truly an honor to be here with each and every single one of you. And I thank you for showing up for yourselves. Just like Dr. Gold said, this is also for you. So as Hayden mentioned, I'm a therapeutic yoga meditation teacher specializing in mental health education, prevention, and treatment. I teach in all different modalities, and I'm currently at an inpatient outpatient programming or intensive outpatient programming for mental health. I teach at USC. I also have a yoga and mental health class. And then I also teach stress management, life skills, meditation, yoga classes at Mount St. Mary's University. So that's just kind of a brief synopsis, as well as training people to be yoga teachers. So it's a huge passion of mine. But like Dr. Gold said, this is also about you. And we want to start by putting on the oxygen mask on yourself first. So let's go into an experiential. Let's just close our eyes. And let's begin focusing on the flow of your breathing. Inhaling and exhaling through the nose. Long, deep, diaphragmatic breathing. And let's practice our diaphragmatic breathing. So let's place our hands on our lower belly. Eyes are closed, gaze rolled up and in, receiving this moment of time for yourself. Inhaling, pushing the belly out towards the hands. Exhaling, navel floats back towards the spine. Inhaling, feeling the belly inflate, pushing out towards the hands. Exhaling, belly deflates, navel floats back towards the spine. Let's move the hands now to either side of your rib cage. Inhaling from the lower belly. Allowing the breath to travel up through the middle chest, feeling the expansion of the rib cage. Pausing the breath here. And exhaling top down, releasing the breath from the middle chest, and then the lower. Let's practice that again. Inhaling from the lower belly. Sipping the breath up through the middle chest. Pausing the breath, feeling the expansion of the lungs. Exhaling, releasing the breath, middle chest, then the lower, completely releasing all the air. Now let's bring our hands onto our upper chest. Inhaling from the lower belly. Sipping the breath through the middle chest. And seeing if we can allow the breath to travel all the way up to the upper chest. Pausing the breath at the top. And slowly exhaling, releasing the breath. Top down, upper chest, middle, lower. Inhaling, lower belly, middle chest, upper chest. Feeling the full expansion, pausing the breath at the top. And exhaling, relaxing the breath, upper chest, middle, lower. Relaxing the hands now onto the knees, palms facing up to receive. Eyes closed, gaze rolled up and in, top of the nose, between the two eyebrows. And keep practicing this diaphragmatic breath. Inhaling from the lower belly. All the way up to the upper chest. Relaxing upper, middle, and lower. And as you're here, let's begin developing a relationship to the breath. See if you can begin hearing the sound of your breathing. And as you're developing this awareness, see if you can begin slowing the breath down. Finding yourself lengthening your inhale. Elongating your exhale. Letting any thoughts or feelings that come into your mind gently pass in and out. No attachment, no judgment. As the Zen Master Thich Nhat Hanh says, feelings come and go like clouds in a windy sky. Conscious breathing is my anchor. Start anchoring down now with the breath. And as you're breathing, let's layer on a mental focus, silently repeating the word inhale as you're inhaling, exhale as you're exhaling, giving your mind something to focus on, and keep strengthening the relationship to the breath, understanding the breath, understanding how the breath travels through the body, understanding where the breath travels. Does the breath travel smoothly through the body? Does the breath get caught anywhere in the body? If so, where in the body? What can that reveal to you? Do you find inhaling easier than the exhale or vice versa? Is the length of your inhale equal to the exhale, or are they different? If so, what is the difference? Keep developing the relationship to the breath, because the breath is the doorway to the higher consciousness. So keep opening up that doorway through the breath. The mind wanders, we thank it for wandering, because it's gifting you the opportunity to bring the mind back to your control with the word inhale as you're inhaling, exhale on the exhale. And as you're here, you may even want to layer on, bringing to mind your sense of purpose. It might be the purpose for the session, for the day. It might be more general, your purpose in life. When we go through life, we can often get disconnected from that sense of purpose, especially when we're working so hard, coming through a pandemic. We can be overwhelmed. So we want to use the breath as a tool to bring us back to that center point of purpose. Breathe it in, breathe it out. And inhale deeply. Suspend the breath at the top. Seal in the purpose into the breath. And slowly exhale, relax the breath, normal breathing. And when you're ready, slowly blink your eyes open. Just bringing to mind maybe how you feel, maybe seeing if there are any shifts from when you first started in your energy, in your emotions. And when you're ready, just blink your eyes open. Let's bring ourselves back into our body, shake our hands a little bit, and have a great big stretch with the arms. Inhale And exhale, swooping the arms all the way down to your sides. So thank you. Welcome, everybody. I hope you were able to dive a little bit deep into that experiential practice. Feel free, if any words kind of came through and you wanted to put it in the chat, feel free to do so. But in the meantime, I'm going to share my screen as I have a little PowerPoint for you all. And like Dr. Gold, I have dogs. I have 3 dogs and 2 cats. So you may hear some animals in the background. So I'm seeing some words here in the chat. I'm seeing some calm, peace, gratitude. Beautiful. Thank you. So, okay, so let's dive deep. Let's look into yoga for trauma-informed care, looking at the bigger picture, looking at these evidence-based practical applications to self-regulate. So we're going to look and understand the objectives and understand the broader meaning of yoga and understand the psychological and the physiological benefits of yoga in healthcare. We're going to look at different ethnic populations and how they're affected to access to yoga. And then you've experienced some techniques, and hopefully we've got a lot to cover, but I hope we'll have 5 minutes at the end to experience another meditation that is got a lot of evidence behind it. And one of my loves and passions is sharing these techniques with people, and then you can go out and share it with your patients, your clients, whoever, your family, passerby in the street. It really is a beautiful practice to share. So let's kind of look at, oh, I apologize, there we go. So let's look at what yoga is. And so I always, let me see some of you. I'm going to see some gallery faces here. Who thinks yoga is like an exercise class? Do we see some hands thinking it's like an exercise class or stretching, right? Who thinks, I've had people say, I don't go to yoga because I'm not vegetarian, and I think I've got to be vegetarian to go to a yoga class, right? I've had that. Or I drink alcohol and I can't go to a yoga class because I drink, right? Let's get all of these preconceptions out of our way and reframe what yoga is. So yoga is unique to everybody. And the way I describe yoga is it is a state of being. The word yoga, it's an ancient practice, and it dates back thousands of years from India. And the translation of the word yoga means to yoke, to join, to unite. And so what it is it's this state of being, in being able to get to a place of feeling whole, feeling so connected to yourself, connecting the self to the self, connecting the individual consciousness to the higher consciousness, feeling completely fulfilled in every aspect of your life. Yoga is a practice, right? And we use the word practice because it is a practice in where through repetitive behaviors, we start seeing changes physiologically and then changes emotionally. And so the way I describe yoga right now is yoga is the science of life. So right now we're in a really exciting evolutionary time. And so the way I describe yoga is it is how to be a human being in this day and age, right? We're living in these really interesting times. And so yoga is about understanding the mind, understanding the body. And this is where the education piece comes in, of what is going on with our system. And then when we have a life event, then we know how to approach it with ease. And so I want to kind of plant the seed, because I like reframing, and we want to think outside the box here. And so we're in this evolutionary time, and when we're evolving, the human race, we're in the midst of it, and we can't necessarily see what is the evolution that's happening. There's been a big technological advance, and so we need to, the human race needs to match where the technology has been going. And so we're seeing these, the younger generations that are coming through of developing what we label as disorders, diseases. Well, I just kind of want to start planting the seed that maybe they're not necessarily disorders or diseases, but it's new ways of evolving the human brain, the human body, to deal with the other evolutionary practices that are coming through. And so I work with usually between the ages of 10 to mid to late 20s. And what I'm seeing over and over and over again with this population is they are so overwhelmed with the world. And they are overwhelmed with this being a sensory system. So I'm going to bring you to my patient P. I've been working with him since December the 4th, 2021. And one of our first sessions, he said, he described himself as being spiritually bankrupt. And I was just blown away with this phrase, spiritually bankrupt. I was just completely taken aback. 23-year-old male, was 5150, and then started coming to IOP for substance abuse and for suicidal ideation. And there was trauma there, but for the main things that he was saying is that he was overwhelmed with the pain of the world. And when I work with people, like how I did with you at the beginning, tapping them into the purpose, I was asking him, what does he think his purpose in life was? And he said he wasn't exactly sure, but it surrounds love. And again, I was like, wow, I was just blown away that this is what he wants to do. This is his calling, and he felt his calling is to be of service, to help people. And so he's seeing the world, the pain. And the way I describe human beings right now is we're a sensory system, and we're like, I'm the visual person, so I like to visualize ourselves as like octopuses. And we've got all of these tentacles with all of these receptor cells, and we're receiving all of this information, all of this noise, all of this pain from the outside world. And we don't have the education, the understanding of how this physical body works, how this mind works. So yoga is this state of being, of understanding how to align the mind, the body, and the spirit. So we're not spiritually bankrupt, so that we can fulfill our purpose. And so his purpose was to be of service, and that it surrounds love. And so how do we do that? So we're looking at the bigger picture of yoga, this is a state of being. It's a state of feeling completely whole within ourselves. And it is a practice. And with practice, what happens is it is opening up our awareness, our consciousness, and that consciousness keeps raising. And so it's kind of like a double-edged sword. Because our consciousness is raising, we're becoming more sensitive to all of the outside noise. So again, we need to learn how to deal with those sensitivities. And so yoga, as well as it being a state of being, as well as it being a practice, it is a way to develop your own first aid kit of self-regulatory practices. And so it enhances our consciousness, so that we can, when we're in a trauma, when we're in a life event, we can actually take a step back, observe the situation, not attached to the event, and span out, learn the lessons, and see the purpose, and understand the purpose behind some of the signaling that is happening when we go through life events. So how do we get there, right? So we get there through, let's span back now more into the micro of what you may be more familiar with of yoga, of the physical postures. So there's a mix of creating specific angles in the body to create a specific effect. So you may want to target your heart, your lungs, kidneys, adrenal glands, etc. There's also a component of breath regulation. So exactly how we practice at the beginning, regulating your breath. And when we regulate our breath, right, often we'll say to patients, take a big breath in, breathe long and deep. But how are your patients breathing? Often patients are breathing paradoxically or shallowly, which is contributing to the anxiety. So if you can teach them the diaphragmatic breathing, even if it's just a minute, getting them into those 3 chambers of the body, it's going to really support their overall mental health and well-being. Another component is deep relaxation. So having the ability to train your body to drop into that relaxed parasympathetic state. And then another component is meditation. So meditation in its simplest form is focusing the mind, right? And we practiced that a little bit at the beginning. We're focusing it on the breath. We also gave it a mental focus of silently repeating a word. Inhale as you are inhaling, exhale on the exhale. So meditation is the ability to start training that monkey mind and focusing the mind on something. On a deeper level, meditation is a scrubbing out of the subconscious garbage of the mind. So every day we clean our teeth. If we didn't clean our teeth would rot. If we don't clean out our mind regularly, guess what? Our mind rots, right? So meditation is that ability to clean out the subconscious garbage of the mind. And then it's also the ability to practice being in the present moment of time. And then it's also the ability to practice observing the mind, right? Observing, like how I said at the beginning, it's beautiful if the mind wanders. That's a natural process of the mind. But what we want to get to a point of being able to control the mind, being able to observe, oh, I'm going there again. I'm going into all of these negative self-talk patterns. Okay, I'm going to observe that. I'm going to breathe, I'm going to self-regulate, and then I'm going to control, and I'm going to bring my mind back to my control. And so it's practicing on the mat, so then you can apply off the mat into your daily life. So that's kind of yoga in those terms. I then want to span back out again into the bigger picture of yoga. So remember, yoga, that state of being, that state of union, that feeling whole. So it's everything that makes you you, everything that you love that lights up your soul. So it could be art, it could be nature, food, people, media, music, sports, whatever it is that lights up your soul, animals, right? It's also, remember, yoga, we're developing this conscious awareness. And so this conscious awareness is about understanding what your body needs, and then also understanding what your body might not necessarily need. So let's just take a look at generally where we are in today's society. We're living in a world where when we go to sleep at night, we're probably hearing the traffic of the city. We've got the city lights that are coming through, so stimulus supporting or not supporting good sleep. Then we have an alarm that will wake us up, not naturally, right? We're not waking up when the sun rises, but we're having this blaring sound, right? That has an impact on our system. Then we go onto our phones, and we're scrolling on social media, or we're looking at the news and we're seeing all of what's going on in the news. All of that has an impact. Everything that we receive, we are digesting. We don't just digest food, but we're digesting all of this information. So yoga is developing the ability to have the conscious awareness to know maybe things to avoid, things to limit. Maybe, it's important to be informed about the news, but maybe you want to start your day instead of on the news, but maybe dancing around your room to 3 minutes of your favorite song, like You Just Don't Care, and see how you feel, right? Compare that to when you get up and watch the news, scroll on social media. So all of that has an impact on yoga, on that state of being, of feeling whole. And so yoga, it's out there everywhere now. Where's my presentation gone? There we go. So yoga has grown a lot over the last few years. So in 2008, there was about 17 million people practicing. And in 2020, it rose up to 55 million. And since the pandemic, it has grown even more. A lot of the people that are practicing are female. So it's about 70% female, and it is predominantly a white-based practice here in the United States. A lot of people that practice the majority are between the ages of 39 or 30 to 49. And about 19% are practicing between the ages of 18 and 29. But as we say, you know, the teens, they're becoming more and more sensitive and more in tune with the way that the world is and the way that they see the world and the current infrastructures. They are seeking these practices out of connection, of deep connection to self. And so yoga, it's being found, it's now being spread across in lots of different modalities. So we're seeing it like in healthcare systems, we're seeing it in schools, we're seeing it in the corporate world. We're also seeing it, we're also seeing it in the US Army. So the US Army have been implementing it, and I used to teach them downtown. I used to give them a good old workout, and they felt the benefits. And Hayden mentioned at the beginning, work with a special forces unit. And in 2017, I received a text message saying, I can't give the details except to say that you made it possible for me to be more effective at my job. And that's the key pieces. These are tools and techniques that self-regulate, and they're quick and they are effective. And so you can go into, you know, the bathroom for 3 minutes, do some long, deep breathing or do a specific meditation, and you will have a physiological change. And so JD in Afghanistan, he shared that he was able to be more effective at his job because of these practices. I'm just going to go back a couple of slides and look at the kinds of yoga that's out there. So there's a lot of different kinds of yoga, and this is just a handful, just a selection. There's probably over 100 different kinds of yoga now that are out there, and a lot of what we call the novelty kinds of yoga. So we've got the acro yoga, which is kind of a combination of acrobatics and yoga. Yoga lattes, which is Pilates and yoga, hot yoga, doing it in the heat. Then we've got more of the traditional lineages of yoga that you may have heard of. So Hatha yoga, Kundalini, Kriya, Ashtanga, Yin, Iyengar. All of these practices, they all combine those 4 components that I mentioned of movement, of posture, of breath regulation, of deep relaxation, and of meditation. So it's a whole combination. They just sometimes, each one may have a slightly different emphasis, a different focus. So one may focus more on alignment. The other may focus more on holding the positions for longer periods of time. Another may focus more on the relaxation aspect. But all roads lead to the same destination of yoga being this state of being, of feeling whole, of this deep connection to self. So yoga is found in all of these different environments. However, it is underutilized among a lot of our ethnic populations. And so there was a qualitative investigation done back in 2017, trying to understand the preconceptions of why yoga is not utilized so much in ethnic populations. And so they found that, they said it was to do with lack of physicality and weight loss, that these were some of their preconceptions, that they had a fear of injury, And one of the big ones was this lack of ability and self-efficacy to perform the practices. So again, we've got these preconceived ideas of what yoga is, and especially in some of these underprivileged, in these ethnic minority backgrounds, there is this lack of education, and so it is not utilized as much. Then they did a follow-up study to see how do we overcome this, right? And so there was a qualitative investigation looking at yoga intervention practices for racial and ethnic minority adolescents in mental health treatment. It was in a community health clinic looking at low-income families in Florida, and it was racial and ethnic minority adolescents between the ages of 12 to 17. And so they said, you know, one of the things, offering free yoga classes, right? Everyone wants free, but it's an important aspect to offer it for those who can't afford it. It really is important. And then promoting the social and the physical and mental benefits. So again, moving through those misconceptions of what yoga is, and then having it being inclusive for all genders, all physical abilities. And so I want to share with you this amazing program called Yoga for Youth. They're this incredible organization which started in the US. They're now all over the world. And they are this organization which provides yoga and mindfulness techniques to ethnic minorities and underprivileged backgrounds. And they go into schools, into juvenile detention centers. And there was actually a randomized control trial done back in 2018 over a 10-week period, looking at yoga and stress and resiliency. And they did before and after stress tests. And the results showed that there was a significant improvement in stress and resiliency after the program. Both the students and the teachers found that there were benefits. And so the conclusions show that this hopefully will provide ethnic minorities in low-income urban schools with these behavioral skills that will protect against risk factors associated with development of behavioral and emotional problems. So we need to do more research, right? So let's go a little bit more in detail with the research. Research started here in the US in about 1975, and through 2014, there was about 312 randomized controlled trials. So research is new. There is not a lot of research that is out there. There is more that there is coming through now over the last few years. But again, we need to hone in, because a lot of these research papers will say it's yoga, but it will be some more of these novelty yogas that don't necessarily focus on all of these components. So we really do want to be mindful with what kind of research that we're looking at. So why do research on yoga? Well, and Dr. Gold was mentioning this earlier also. So there is an increase in general population practicing as an integrative component for health and wellness. And so we need the data, we need the evidence to back it up. If we're wanting to implement this in healthcare systems, in schools, in universities, in governments, it is the age-old question, why, right? I'm going to invest in something. What are the benefits? What am I going to receive out of it? So that is why we need to do research. It's also to reach populations that don't have access to yoga and or knowledge. So we can give it to those ethnic minorities that aren't necessarily educated on it. Again, we need to have the data, the evidence to back it up. And same with just promoting the use in general and for the general public. Some of the challenges with research is practitioners versus researchers. So the majority of people are practicing yoga as opposed to researching, doing the research. It's costly. So to do a full study, it's anywhere in the range of and actually it's getting up there to about $5 million for a full study. And a preliminary for like one of the pilot studies, it's about 700,000. And the studies are lengthy. So a full study is about 5 years, and then a preliminary study is about 3 years. So those are some of the challenges with research. And also, because it is still a new practice, thank you, Dr. Gold, for putting in Yoga for Youth in the chat. Because it is still a relatively new practice, when we are doing these trials, the population size is sometimes can be quite small. So that's some of the other challenges. So let's look at the research now. So some of the research is qualitative studies and just generally looking using before and after mood anxiety questionnaires like the perceived stress scale, the resilience scale, to look before and after. And in general, we're seeing after a yoga program, in general, improvements in general mood, stress, anxiety, and depressive symptoms. Then we've got the quantitative studies, which I get super excited about, right? Using some of the MRI and the PET scans. And we're seeing changes in neurotransmitter levels. We're seeing influences in inflammatory processes. We're affecting gene expression, and we're regulating endocrine immune responses and improving cognitive function. So there is a lot that's going on when we're practicing. And so I just want to highlight a couple of these studies that have been happening. So yoga for substance abuse. So some of the yoga interventions, there was a 90-day residential program done in India at a psychiatry hospital with those who have substance abuse. And they were practicing 3 times a day. And the participants, they reported greater emotional well-being, less pain, less reactivity, and improved sleep. There was another randomized control trial of yoga for stress and substance abuse for those who have HIV, who are living with HIV. And they were given 90-minute sessions over a 12-week period. And the other group was just a treatment group. And they looked at 1 month, 2 months, and 3 months. And each month, the yoga group showed less days of substance use than in the treatment group. So again, showing that there is some benefits. Looking at cortisol levels, yoga and cortisol levels and stress. So we know cortisol is a component in our stress response, and there was a longitudinal and an immediate effect study looking at yoga on salivary cortisol levels and perceived stress. 26 participants between the ages of 18 and 45, 13 in the control, 13 in the yoga group, and they were collected salivary samples, and they showed that immediately after the yoga group, there was a significant difference compared to the control group. And again, with the perceived stress scale at the 3-month mark, there were significant differences in improvement in overall mood, depressive symptoms, anxiety, etc. Yoga, GABA, and mood and anxiety. So again, we're looking at how yoga can have an effect on those neurotransmitters. So there was another study that was done looking at mood and anxiety. It was over a 12-week period of the effects of yoga compared to walking on mood and anxiety. 12 weeks period, 1 class 3 times a week, and it showed that there was an increase in GABA levels after the yoga class, which is amazing. And then in general, they showed improvement in mood. So we're seeing these physiological changes when we're doing these practices. And then I'm going to come to our final meditation. Where there's been, I would say, I think over 50 different kinds of studies on this meditation, and it's called Kirtan Kriya. and it's combining sound, it's combining movement and breath. And what they found was that there were 68 genes that were differentially expressed after a 3-month yoga practice. 19 were upregulated genes, including immunoglobulin-related transcripts, and then there were 49 downregulated transcripts, which included pro-inflammatory cytokines. And this is really exciting because what it shows is that yoga can support the immune system by increasing antibodies and decreasing cells that promote inflammation. So when we go through stress, when we go through trauma, it is really important. And also with this specific meditation, we've seen some changes in telomere activity. So telomeres are little protective DNA proteins at the end of chromosomes, and the length shortens with age. And the rate of telomere shortening may indicate the pace of aging. And so lifestyle factors, stress, substance abuse, all of that has an impact on the telomere activity. And there was this amazing study that was done looking at caregivers for those who have dementia, and the caregivers reported depressive symptoms. And so they did this study that looked at, I think there was 39 caregivers practicing this meditation over a 12-week period. And it showed that there was and it compared to a music group listening to music. And it showed that there was a 43% improvement in telomere activity compared to the music group of 3.7%. Therefore, showing that this specific meditation can improve stress-induced cellular aging. And they also reported they had the perceived stress scale test. They also reported significantly lower depressive symptoms and just general improvement in their mental health. So that's just a quick synopsis of the research. I know there was a lot to cover here, and I was trying to leave time for questions and our practice at the end. So just to kind of close things up, the pathway forward. So out in the world, in Sweden, yoga has been implemented into the healthcare system. There's about 80 hospitals. We're not quite there yet in the US. We are a little bit more resistant, but we're hopeful. And the VA is very open to integrative health and wellness, including yoga to support mental health. So that's kind of a good way in. And one of the things is also that insurance companies now are also being slowly starting to accept it through insurance. So those are some good things that were coming through. And then just in summary, for what we've just covered, yoga is a state of being. It's this deep connection to self, a state of feeling whole. It can be, but not limited to, a combination of movement, of breath regulation, of deep relaxation, and meditation, leading to positive behavioral changes, overall health and well-being. Science is catching up with what the yogis knew thousands of years ago, but more research needs to be conducted. So feel inspired and be inspired. If this resonates with you and you want to share some of these practices, please, we put the oxygen mask on ourselves first. We practice what we preach, exactly what Dr. Gold said. I have my daily yoga practice. I have my grounding techniques. I make sure I get out in nature. I'm very mindful of the food that I'm consuming. I'm mindful of the social media, the news, etc. So really just start looking at the broader picture of yoga and how we can implement it. So thank you, everybody. It has been a pleasure.